Integumentary System. This system of human body is related to skin. Question: what are the skin appendages? Answer: skin appendages contains 1. Sebaceous glands. Sebaceous glands are associated with hair follicles and secret sebum that waterproofs and moisturizes the hair shafts. 2. Sweat glands. 3. Nails. 4. Hair. Integumentary System Question Bank. 1. Write down the layers of skin including epidermis. 2. Write down the contents of dermis. 3. What are the common functions of skin? 4. Write down the common skin diseases. Define ringworm with types. 5. Define eczema with clinical feature. Acute and chronic? 6. Define scale, atrophy, psoriasis, vulvovaginal candidiasis, scabies, herpes simplex, impetigo, boil, abscess, acne vulgaris, urticaria, and ulcer. Question: no 1. Write down the layers of skin including epidermis. Skin consists of 3 layers. 1. Epidermis. 2. Dermis and 3. Hypodermis. Top layer epidermis. It is made up of 5 layers. 1. Stratum corneum horny layer. 2. Stratum lucidum clear layer. 3. Stratum granulosum granular layer. 4. Stratum spinosum spiny layer. Prickle cell. Melanin production gives skin its color. 5. Stratum germinativum basal layer. Cell divides and grow upward. The epidermis is made up of stratified squamous epithelium and lacks blood vessels. Melanocytes, which lie deep in the epidermis and underlying dermis, produce a pigment called melanin that protects deeper cells from the sun's ultraviolet rays. Question: no 2. Write down the contents of dermis. Dermis is the middle layer of skin. Middle layer dermis is made up of blood vessels, supply nutrients to the skin. Lymph vessels, defense mechanism for the immune system. Hair follicle, protection and sebum production. Sweat glands, regulators of heat. Pain and touch receptors, carry impulse to the brain. Hypodermis is the bottom layer of skin. Subcutaneous fat, the bottom layer. Bottom layer hypodermis. The hypodermis, subcutaneous layer, is composed of loose connective tissue and adipose tissue. Question: no 3. What are the common functions of skin? Function of the skin: protection, an anatomical barrier from pathogens and damage between the internal and external environment in bodily defense. Sensation: contain a variety of nerve endings that's sensitive to heat, cold, touch, pressure, vibration, and tissue injury. Regulate of body temperature. Control of evaporation: the skin provides a relatively dry and semi-impermeable barrier to fluid loss. Storage and synthesis: acts as a storage center for lipids and water. Skin also helps in vitamin synthesis. Water resistance: the skin acts as a water-resistant barrier so essential nutrients are not washed out of the body. Question: no 4. Write down the common skin diseases. Define ringworm with types. Common skin disease: 1. Eczema. 2. Psoriasis. 3. Skin infection. A. Fungal, ringworm, tinea infection. Candidiasis. B. Arthropods, scabies. C. Viral, herpes zoster, herpes simplex. D. Bacterial, impetigo, boil, abscess, disorder of pilosebaceous unit at acne vulgaris. 4. Disorder of pilosebaceous unit. A. Acne vulgaris. B. Rosacea. 5. Skin tumors. Benign, seborrheic keratosis. Premalignant, actinic keratosis. 6. Malignant, basal cell carcinoma, squamous cell carcinoma, malignant melanoma. Ringworm with types. Ringworm, tinea, is a clinical condition caused by fungal infection of the skin. The classic presentation of tinea infection, known as ringworm, is a lesion with central clearing surrounded by an advancing, red, scaly, elevated border. Ringworm is due to infection by dermatophyte fungi. There are 3 main generations. Trichophyton, skin, hair and nail infections. Microsporum, skin and hairs. Epidermophyton, skin and nails. Types of ringworms/tinea infection. A. Tinea pedis, athlete's foot, affects the feet. Soggy interdigital scaling, diffuse powdery scaling of the soles. B. Tinea unguium, tinea of the nails, usually few nails are infected. C. Tinea manuum, tinea of the hands, usually asymmetrical and involves palms. D. Tinea crucis, tinea of the groin, men are more affected, well-demarcated redness and peripheral scaling of Gorins, upper things. Usually unilateral and itchy. E. Tinea corporis, tinea of the trunk, affects the arms, legs and trunk. Widespread and itchy if untreated. F. Tinea capitis, tinea of the scalp, affects the scalp. Baldness, slightly scaly patches with the hairs broken off a few from the scalp. G. Tinea barbae, affects facial hair. 5. Define eczema with clinical feature, acute and chronic? Eczema. The term eczema and dermatitis, inflammation of skin, are now used by synonymously. Eczema is an inflammatory response of the skin, characterized clinically by itching, clustered papillovesicles with erythema and scaling, and histologically by spongiosis, epidermal edema. Clinical feature of eczema. Acute eczema. 1. Severe itching, burning sensation, pain. 2. Redness and swelling, usually with ill-defined margin. 3. Papules, vesicles and rarely blisters. 4. Exudation, cracking and scaling. Chronic eczema. 1. Severe itching. 2. Thickening, lichenification. A dry leathery thickening with increased skin markings is secondary to rubbing and scratching. 3. Fissures and scratch marks, pigmentation. Question No. 6. Define, scale, atrophy, psoriasis, vulvovaginal candidiasis, scabies, herpes simplex, impetigo, boil, abscess, acne vulgaris, urticaria, and ulcer. Scale, dry or greasy laminated masses of keratin that represent thickened stratum corneum. Atrophy refers to a loss of tissue, and can be epidermal, dermal, or subcutaneous. With epidermal atrophy, the skin appears thin, translucent, and wrinkled. Psoriasis. Psoriasis is a non-infectious, inflammatory disease of the skin characterized by well-defined erythematous plaques with large, adherent, silvery scales. Vulvovaginal candidiasis. Candida albicans is an opportunistic fungal pathogen that is responsible for candidiasis of the vulva and vagina. It is commonly called thrush or manilia. Scabies. Scabies is a highly contagious itchy skin condition caused by infestation of mites, arthropods, Sarcoptes scabii. Herpes simplex is a viral infection caused by a group of herpes viruses, which may produce cold sores, genital inflammation, or conjunctivitis. Impetigo is a contagious, superficial infection of the skin caused by Streptococcus and Staphylococcus bacteria. Boil, also called a furuncle, is a deep folliculitis, infection of the hair follicle. It is most commonly caused by infection by the bacterium Staphylococcus aureus, resulting in a painful swollen area on the skin caused by an accumulation of pus and dead tissue. Abscess. An abscess is a localized collection of pus in a cavity lined by pyogenic membrane. Acne vulgaris. Acne vulgaris is a skin condition characterized by red pimples on the skin, especially on the face, due to inflamed or infected sebaceous glands and prevalent chiefly among adolescents. Urticaria. Urticaria is an eruption of itchy wheals caused by allergic reactions. Ulcer. An ulcer is a discontinuity of the skin exhibiting complete loss of epidermis and often portions of the dermis and even subcutaneous fat.